Hello, dear aspirants. Welcome you all to the Master Nursing classes. Myself, Mr. Nagraj, your NORCET mentor and guide, here in front of you all today to discuss the very important last day of our crash course session. We are already in the end of our crash course session. Students who all are watching my live video daily, yes, you all of you know that we have started the 8-day crash course session for our Nimhans exams, where I am covering your entire psychiatric nursing syllabus, okay, in very short duration of time without wasting the time. Only yes, the our syllabus related we have discussed only related to our exams. There is no any faltu boss in the complete our crash course session, students. So we have completed successfully at day 7 crash course session yesterday. Yes, today is the day 8 psychiatric for Nimhans crash course session. This is the last day of the session. Very importantly, we have covered the whole vital topic of the psychiatric nursing, or we call the mental health nursing, for our Nimhans examination. Yes, this classes are going to be a very vital classes for your yes NORCET exams also, DSSB also, military nursing services also. So where in the each and every exams there is possibilities of the 3 to 4 questions from the Nimhans, or sorry, from the psychiatric syllabus, students. As of all of you know that there are around 3 to 4 questions came in our mains exam of the NORCET. 3 to 4 questions also there in the prelims exam. Yes, in the last 2 years, at least 9 to 8 to 9 questions which are arising in the our all nursing competitive exams from the psychiatric nursing, okay, where those 8 to 9 questions is going to be a very important and your rank deciding questions, students, where the many of the peoples who all are neglecting the psychiatric nursing, so they will be lag behind you with 8 to 9 marks, students. If you are yes the proper perfect with the psychiatric nursing, you all are standing away from the crowd with the good ranks, okay, so that makes you a champion, students. So who all are watching day 1 to day 8 sessions, I think you are 99% syllabus from the psychiatric nursing, that is very important for our competitive exams, is completed, students. Hope these all sessions are very helpful for you. We are at the end of the crash course session, that is the psychiatric nursing crash course sessions for the Nimhans, okay, very important for the NORCET also, okay. In this today's sessions, as I have told in the previous sessions only, the vital importance, the very importance, and the 100% possibilities of arising questions, so those topics I will teach you in the last day I have told. So in today's sessions I am dealing with the very important sessions, that is the ego defense mechanisms, the basic theories that we need to know in the psychiatric nursing, and very importantly I am dealing with the some emergencies which are arises in the psychiatric hospitals, okay. We are dealing from the very basic to the very upgraded session we will take in today's sessions. So be connected with the master nursing classes, and at the end of the sessions I will definitely tell some very helpful tricks and tips for your in competitive exams, where I am sharing you some few points where you need to consider in your mind to approach the paper. So how much questions you have to attend, okay, and how you should analyze the paper when the paper starts in front of you, I will discuss at the end of the session, okay. Do watch the video completely. If you have any small doubt, also comment in the comment box, okay. If you are having any doubts, means you can just mention in the live chat, where I will be present for the complete class, okay. So we will discuss there, okay. If any minor doubt also, don't keep any confusion in your mind, since from my first video to last video, if there is any doubt, just comment here, I will respond to your questions, students, okay. Without wasting time, we'll start the class. Here is one beautiful question from in front of you all. Just read the question carefully and try to answer for the questions. Don't do any gutbad, because these are the very basic questions where the 90% of students are going to mark it as a right answer, okay. Yes, look over the question. Here is the question. According to the Sigmund Freud, three major hypothetical structure of the mind includes all except, yes, if you all of you know the, yes, the what are the hypothetical structure of the mind according to the Sigmund Freud. Yes, Sigmund Freud is be also called as the father of the, yes, psychosexual developmental theory, or we also call it as the psychoanalytical developmental theory, okay. Who is the father of the those psychosexual and psychoanalytical developmental theory? Yes, the Sigmund Freud. Yes, the Sigmund Freud given the three major hypothetical structure of the mind, that includes, yes, that includes first one is ego, superego, okay. And there are the structures of the minds also based on the, yes, the level of the consciousness, that is then pre-conscious, semi-conscious, and unconscious. So these are the different types of the structures mind, okay, where we want to know what are the hypothetical structure of the mind that is given by Sigmund Freud, sir. Yes, the id, ego, and yes, the super ego. These are also called as the structure of the personality also. Okay, very importantly, you have to know this all things. Yes, if the examiner asks this much only in question, yes, students, if he asking like this only, you are 99% of all of you will mention the correct answer. But how the examiner will ask in the question? Yes, let us deal that with that one. Yes, I will ask you one question. Just mention the answer in the comment box. Okay. So if you are going with your kid, okay, on the road, if you will find one tree with mango in the compound of the other's home, okay, so where your child is crying and he is showing temper tantrum and he is asking, I want that mango at any cost. I don't know what you will do. I want that mango at any cost. So which structure of the personality the child is showing here, friends? Yes, just mention in the comment box. Yes, all of you very correct. Yes, yes. The child is showing the id. What is the id? Id is the yes students where the child is having yes the personality or the structure of mind the child is having as an yes it working on the principle of pleasure where it he is or she is not thinking about any consequences only they are focused over the pleasure. So where the id works on the principle of the pleasure where the person act like they don't know about any consequences, just they want means they want, so nothing they have know about that. So that is what we call the principle of the pleasure is where they are only focused over their gratifications. Okay, so they don't think over the consequences. Yes, they, that is what we call the id. That is the first structure of our personality, id. So then what is ego? Yes, the id works on the principle of the pleasure. Yes, id works on the principle of the pleasure. Yes, let me write. Yes. What is the ego? Yes. Ego works on the principle of the yes. Comment in the comment box. Yes. How the ego works and how the super ego works. Come on, students. I'm waiting for your answers. Yes. Id works on the principle of the pleasure. Ego works on the principle of yes. Come on. Principle of reality, students. Either works on the principles of the reality where they will think. See the same example I will give. The child, you are going with the child in a street, you will find one mango tree, same. Okay, and where the child is looking at the door of the owner, he is telling if there is no any owner, you take the mango. If owner, yes, please skip it and go away. So like this, they are working on the reality where if there is no any what we call, if there is no any owners we can take the mango because no one is seeing that one. So that is based on the reality they are working. So that is what we call as the our hypothetical structure of the mind or the structure of the personality, that is the ego, that works on the reality principles. Then how the super ego works? Yes, come on, comment in the comment box. Super ego works, students, it's based on the yes perfection principle. Very very good. Yes, very good, students, all of your answer are correct. So all of your preparation is in the right direction. So where if in case the mango is on the street only where you are going, so the person will think don't we will don't steal that one. Okay, why? Because the God is seeing us, so we don't want to do any stealing. Okay, that's what the super ego works on the principle of the perfection. Okay, so the id works on the principle of the pleasure, ego works on the principle of the reality, and super ego works on the principle of the perfection. This is what the examiner is going to ask in your yes exam while creating the scenario based questions. Like I have given examples like the child with yes the parents who all are going over the street. So three situations I have created and explained you. Okay, these all are the three major hypothetical structure of the mind that is given by the Sigmund Freud. Okay, and we what is the question here? The three major yes hypothetical structure of the mind includes all except. Okay, we need to consider which one is the accepted one. Yes, except is the preoccupation is a not a our yes the hypothetical structure of the mind where the preoccupation is we are eliminating. Okay, this is our correct answer. Okay, hope the concept is clear for all of you. Yes, here is the next question. Yes, read the question carefully and try to answer for the question. So according to the Erikson theory, autonomy versus same seen in which age group? Yes, here is our question, very beautiful question. So I am explaining complete 8 stages of the Erikson, where we will remember the e e e 8 stages of Erikson that explains the psychosocial developmental theory. Students, this is not in psychosexual, not in psychoanalytic, that is different one, that is given by our, yes, the Sigmund Freud. Here the 8 stages of the Erikson theory that is given by our Erikson, where he described how the child will grow socially and what are the contributory factor and the mother parents relationship, and how the child will manifestations according to um, the what the previously he have gone through in the particular situations. So that is what he given in the psychosocial theory that is given by the Erikson. Okay, hope one concept is clear here. Okay, so the what examiner asking in this question, yes, according to Erikson theory, autonomy versus shame seen in which age group? Yes, almost all of you corrected this one as in correct answer. I'm very proud of you. Okay, so keep this same consistency till your exams. Definitely, I will tell with confidence you all going to become a nursing officer in central government exam. Students, yes, autonomy versus shame seen in very room, that is seen in the age group of the toddler. You can remember to auto, here the toddler auto you can remember. Okay, to auto, simple you can remember. Okay, so according to Erikson theory, autonomy versus shame seen in the which age group? That is seen in the toddler age group. We will discuss all 8 stages because the examiner may create anywhere answer from this one. Okay, so we are having the, yes, 8 stages from the infancy, early childhood, play age, that is the, yes, the preschooler, schooler, adolescent, early adolescent, and middle adolescent, and old age students. Very very importantly, we are having the 8 stages. Okay, so where the stage first infancy begins from. This is not 0 to 1 year. This is 0 to 18 months. Students, please do correct here. That is the 0 to 18 months. Yes, the infancy, where if the mother is good with the growing child, if the mother is daily superly taking care of the child without any deficiency, where the child builds a trust over the mother. So where the trust builds here, students. Okay, if the mother is daily having the not giving time to the child, and she is not taking care of the child, means where the child builds the, yes, the mistrust with the mother, where we call that is then the trust versus mistrust. Okay, the virtue here will develop the hope. If the baby having the hope over the mother, means it will comes as in trust. If the baby is not having any hope over the mother, so he will manifest as the mistrust. Where the in the stage of the infancy, that is 0.0 to, yes, 18 months here in these particular students, that is the 0.80 to 18 months. Actually infancy is the age given as the correct, but in the Erikson theory of the psychosocial development, so the infancy considered as 0 to 18 months. If you look over the standard books, that is all standard book mentioned the 0.18 months, 0 to 18 months. Okay, keep in your mind, if the examiner is also asking your according to Erikson theory, so you mention infancy period from the 0 to 18 month only. Okay, so that's, I hope you all are understood that one. Okay, so in infancy, trust versus mistrust we will see, and in the early childhood. Okay, so, or this early childhood 1 to 3 year age, we call this then the toddler age. Okay, toddler age, autonomy versus shame and doubt. We will see. Okay, so what happening here? Here, the if the child is doing any initiative work, and where he failure to do that work, means if the mother is appreciating, don't worry, nothing will happen. Just try again. If the mother is telling, the child will develop the autonomy. Students, where the for the mistake done by the child, if the mother is taking strict action, if the mother is scolding like anything, means the child will develop shame and doubt himself in his personality, where in future where he want to take any decision, he is not autonomous. Students, he is always having the doubt and shame in herself. So in the psychosocial developmental theory, that describes entire life of this that affects the entire life of the child in the future. Students, very important, if you are also having any child in your home, don't do any strict sections, don't scold for unnecessary thing, because the child's personality will go in the same and out, where they can unable to take any autonomously, they are unable to take any decision in their life. Okay, If they are appreciating means the will develop, not appreciating means the shame and doubt will develop. Okay, so where you can remember this one as in, yes, the to auto, that is the in the toddler autonomy versus shame will develop, where in the preschooler in the play age, that is the age group from the 3 to 6 year. Okay, if the, yes, we can remember this one as in PIG fig. Okay, PIG fig. How you can remember PIG fig in the preschooler? Okay, in the preschooler, yes, in the preschooler initiation versus guilt we will see. You can remember for your exams. Okay, if they have mentioned in initiative versus guilt, we will see in the age of the preschooler. Okay, you can remember, and in the school age there is ISI. We can remember this one as a with the tricks of the, yes. Let me change the color of the pen here. Yes, you can remember this one. Okay. Initiative versus, sorry, industry versus imperative, we will see in the school age children. Okay. Hope you will remember this one. I think my tricks are helpful for you all. Okay. School age, you can remember ISI. Okay. So that is industry versus inferiority, we will see in the school age children. And in the adolescence, do ado, you can id, okay, ado, you can remember this one. Okay, so in the adolescence, identity versus confusion is there. Okay, and in the early adulthood, there is intimacy versus isolation is there. And the hope is, so the virtue here the develop which develops is a love. If the person is getting sufficient love means he is intimacy, and he is not getting any love means, so he will be in the isolation. Okay, so the middle age, which determines the generativity and the stagnation, where he earned sufficient money, where he earned sufficient self-esteem. Okay, he is having the prestigious life in his previous year means he will be in the stage of the generativity. And if he is unable to earn the sufficient financially, is unable to fit. Okay, and he is having some yes, the intimacy issues. Okay, and he is stagnant his throughout his activity age means, where the person will go in the stagnation. So generativity with the stagnation we will see in the middle age. Okay, that is from the 30 to 64 years students. In the old age we are having the, yes, the integrity versus despair. Okay, integrity versus despair you will see in the, yes, at the old age above the 65 year. So these 8 stages of the development, most importantly, where from here the examiner asked the question, from examiner asked the question from the infancy period, from the trust and mistrust, yes, in the our preschooler, yes, in the toddler phase. Okay, especially, so these three are very important. And last one, old age, if the examiner asking question from Erikson stage, you can remember at least 4: infancy, earlier childhood, yes, the preschooler, and the old age. From the here only the examiner will ask the question. Hope the concept is clear. And here is the answer for autonomy versus shame is seen in the, yes, the toddler group of the, yes, 8 stages of the Erikson theory. You can remember how many stages? Yes, the 8 stages that is given by the Erikson. The theory name is the psychosocial developmental theory. Students, very important. That is the psychosocial developmental theory. Don't confuse. Psychosexual is given by the Sigmund Freud, and psychoanalytic also given by the Sigmund Freud. Both are the same only. And here the psychosocial is given by the, yes, the Erikson. Hope the concept is clear. Here is the next question for you all. Okay, very basic concept you can remember. Okay, and you can get the marks for that one. Yes, read the question carefully and try to answer for the question. Students, in each and every one single particular multiple choice question, I am solving entire one topic that may helps for your exam students. Okay, that saves your time, that helps to revise you very rapidly without wasting the time. That is the specialty of the master nursing classes. Yes, who all are new to the video, who all are watching the video first time, if you are new to the channel, please do subscribe to my channel, press the like button and share the video very importantly with your friends. Yes, your juniors, seniors, if you having the students means, we can, you can share with them also, so they can also learn easily psychiatry. Okay, so entire psychiatry I have discussed from the day 1 to day 8. Okay, so this is our last day sessions related to psychiatry, where I am discussing the very important and just the very basic questions of the psychiatric test. Here is the question like this. According to Sigmund Freud's psychosexual developmental theory, the child center of gratification is the lip, mouth, and tongue, seen in which stage? Which stage? Very importantly, yes, we are having the, what are the stages of the psychosexual developmental theory that is given by the Sigmund Freud. That is O. Yes, all of you know that O, yes, APG, yes, oral stage we are having. Very importantly, anal stage, phallic stage, latent stage, and genital stage, where the center of gratification in the oral stage is the lip, mouth, tongue. Yes, lip, mouth, tongue, where the entire focus of development and growth is over the lip, mouth, and tongue, where the child is able to try to suck, try to chew, and try to hold something in his mouth in the age of the yes infancy, where we will see a oral stage is the first stage where the center of gratification is towards the lip, mouth, and tongue. So the answer A is the correct here. Okay, all of you have corrected this answer. Very beautiful. I think all of you have studied this theory previously also. Just we are rewinding and whole are first, so we are explaining the explanation also. Okay, do focus on the explanation also. In the oral stage, that is the first stage of the psychosexual developmental theory. The entire center of the gratification is over lips, mouth, and tongue, where the child is learns to how to suck, how to chew, and all. The child will learn. Okay, in the oral stage. Yes, let me explain entire theory here. Yes, this is the psychosexual theory given by the Sigmund Freud. We are having the oral stage. Okay, then we are having the anal stage, phallic stage, latent stage, and genital stage. Okay, this is also the age group of the oral stage in the infancy that goes to, yes, very importantly, do correct this one, 0 to 18 months. Okay, 0 to 18 months. Then 18 months to 3 year, this one. 18 months to 3 year anal stage, where the oral stage in the infancy period, that is the 0 to 18 month. Okay, so the focus is on the oral activities like sucking and testing and all. Okay, what happens in the anal stage? Anal stage, yes, the toilet training will begins in the anal stage in the age group of the 1 to 3 years, or the 18 months to 3 year. The very best answer goes to 18 months to 3 year, where the center of gratification is the anal area, where the child is try to control the bowel, bladder, and all, where the child learns to toilet, how to go to the toilet, what to do, and all. So the toilet trainings is in the stage of the anal stage. That is the second stage of the psychosexual developmental theory that is given by the Sigmund Freud. Okay, and after that we are having the phallic stage, where the examiner may ask the question from the phallic stage in the form of scenario or situation based question. Yes, how he will ask the question, yes, let me discuss here. Okay, so in the phallic stage, which begins from the 3 years to 6 years, students, what happens here? The child is possessive against the possessive against a same gender, and he is having the, yes, he is having the interest in the opposite gender, where the male baby is having interest in the mother, and female baby having interest in the father. We will study, we will remember for the remember purpose, we will write that one as an, yes, the male baby interested over the mother. Okay, and yes, we will write that one as the mom, and the female baby interested over the father. Okay, F, E, F. Okay, very important. So, what is the mom here, students? If the male baby means the male, the mother means the female, where the they are attracted over the opposite sex and they are eliminating one's own sex. So we call that is in the phallic stage. In the phallic stage, what happens? Okay, male babies are attracted towards the mother. That particular, yes, that particular complex we call that is an Oedipus complex. What happens in the Oedipus complex? Yes, the male babies are attracted towards the mother. Okay, we can remember that was in a mom, where the male baby is attracted towards the mother. We call that is in the Oedipus complex. Hope the tricks is helpful for you. And we are having the PEP, PEF, PEP, where the female baby is attracted towards the mother and avoiding the father. Okay, female baby is trying to comb like her father. Okay, and trying to dress like her father, where she is having the attraction towards her father. So we call that is in the PEP, that is the FEF, female baby is doing and having the interest over the father. We call that is in the Electra complex, and maybe will be having the interest in the mother. We call that is the Oedipus complex. PEP and mom, that helps to solve your question in exams. Okay, very importantly, you should remember in the phallic stage we are having the Oedipus complex and Electra complex, where in the Oedipus complex male baby is attracted towards the mother, and in the Electra complex female baby is attracted towards the father, where the, yes, the opposite gender gratification is there and possession towards the one's own gender. Okay, I hope the concept is clear about the phallic phase. We are having the two complex, Oedipus and Electra. I have cleared that one. Okay, here's the latent phase, where in the latent phase the child is start to, yes, the social relationship he will start. Okay, socially he will go out and he will meet friends. The age will start from the 6 year to puberty. Okay, and gender roles he will identify, where in the genital stage, yes, where in the genital stage baby try to make the satisfactory relationship with opposite gender, that is we will see in the genital stage, that starts from the puberty to adult age. Okay, very very important. We are having the five stages of the psychosexual development, that starts with the oral stage, anal stage, phallic stage, latent stage, genital stage. Okay, so five stages we are having. Especially in the oral stage, the center of gratification is the, yes, very importantly, lip, mouth, tongue, where the baby will start to suck and chew and all. Okay, where in the anal stage there is toilet training is there, and in the phallic space we have discussed the oedipal complex and electra complex, and in the latent stage we have discussed the social relationship is the very important, and the gender role that baby is trying to identify. Okay, and in the genital stage we are having the, yes, the satisfactory relationships, that what we call the baby, or the, sorry, not a baby, the child is try to establish the satisfactory stage sexual relationship with the opposite gender, that is we will see in the genital stage, where the center of gratification is over the genital area. Okay, so I hope the concept is clear related to psychosexual developmental theory of the Sigmund Freud. Yes, let me go for the next class. Here is the next question for you all. Let's read the question carefully and try to answer for the question. Yes, students, as I have told, for each and every multiple choice question, there is one concept for you all that is going to be very true and is very effective for your exam, students. Okay. Here is the next question. Read the question carefully and try to answer for the question. Yes. In five stages of the Abraham Maslow's hierarchy need, which is not a part of the dependency need. Yes, all of you have solved the many questions on the, yes, the Maslow's hierarchy need. All of you know that what is the basic need, what is the safety need, what is the love and belongings, just self-esteem need. Okay, love, self-actualization need. So here we are having two categories of the need. So that is broadly given by the, yes, the Abraham Maslow. So one is, yes, the deficiency need, another one are growing need, where up to the, yes, up to the self-esteem, yes, from the basic up to the self-esteem. Look over here, from the basic need up to the self-esteem means up to here, these all things are very necessary and basic. Okay, after satisfying these all things only, the person can grow more than his ability. That is what we call the self actualization. Okay, self actualization is the only one, yes, only one growing need. Okay, rest all are the deficiency need. Okay, so when you start giving the priority over here, you will start from the, that's the down of the triangle to the up, where the priority one is the physiological need. Okay, then you will go for the safety need, then you will go for the love and belongings. Okay, and self-esteem need and self-actualization need. Where in the physiological need we are having the food, water, warmth, rest, sex. So okay, each and every physiological things we want to, yes, regulate our daily life. Without the physiological need, living is a very difficult one. Okay, in the physiological need that comes over air, without air we can't live, without food we can't live, without water also we can't live, without rest also we can't live. So these all are the very basic needs, there is the physiological needs. Okay, where in the safety needs also there is an, what we call the security and safety is necessary, where the person will complete with his physiological need, he will go for the safety need. Okay, where he will try to secure himself, he will try to secure his family. Okay, he is trying to secure his property. So that is when the person will go, when he will achieve the all basic need, that is the physiological need he is having in hand in the sufficient amount, means he will jump for the next stage, that is the safety stage, where he will try to secure everything. Okay, and if he is having the secure, then he will go for the love and belongings. Okay, where he will he will start some he will start with on some beautiful relationships. Okay, like he will start with some beautiful friends, will make the marriage and all in the love and belonging stage, where this stage completes means he will go to the next stage. Okay, that is the, yes, very important, our self-esteem stage, where he will find some prestige. Okay, and feeling of the accomplishment is there. These all are the deficiency need. Okay, so After getting one basic need only, the person will go for the next need. So here he will go from the basic to the next up to self actualization, where only one need is there, that is the growing need. Okay, rest all are the deficiency need. Okay, and in the basic need that will come first to are the basic need, then psychological need, then self fulfillment is need. This self fulfillment need we also called as in the growing. Yes, the growing need. Okay, these are for psychological need and basic needs we call the deficiency need. Okay, here in our question, yes, which is in five stages of the Abraham Maslow hierarchy need, which is not a part of the deficiency need, means the self actualization is not a part of the deficiency need, students. The self actualization is in, yes, the self actualization is in part of the growing need. Okay, rest all these fours are the, yes, very importantly these fours are the part of the our deficiency need. Okay, yes, we are having here. These all are the deficiency need, and option is self actualization only one, that is our growing need. Hope we have discussed all thing over the Maslow hierarchy theory. So in the physiological need, all physiology is the very much necessary. That is very helpful for the regulation of the daily life. That including the food, water, air, warmth, rest, sex, and all, it will come in the physiological need. And in the safety, security, and love belongings we have explained. So what is the highest need means? Highest need is the our self actualization need. What is the very priority need we will focus? That is the physiological need. Okay, why? Because it's the priority. Without the physiological need accomplishment, the person will unable to live. Okay, he will can't live in one at least quality life. Friends, if you want to live at least quality life, he should have the all physiological need in his hand. Then only he will live some kind of the quality life. Okay, so this is the answer for your option. E is the growing need. All are the deficiency need. Okay, hope your concept is clear related to the Abraham Maslow's hierarchy need, where it is we will use to prioritize for our what we call the nursing diagnosis also by using the Maslow's hierarchy need when the patient comes with us, because we will always give priority for the very basic, very physiological need we will start. Okay, so that is also helpful for us also for a nursing diagnosis in the Maslow's hierarchy need. Okay, so hope the concept is clear. Here is the next question for you all. Read the question carefully and try to answer for the question. Yes. Here your ego defense mechanisms are started. Okay. Yes. Question is like this: a student who fails in exam becomes a sport champion of the college. Okay. Identify this type of the deficiency mechanism. Okay. So what happening here? A student who is failing in exam becomes a sport champion of that college. So he is compensating here. Whatever he is having the deficiency, he is covering, he is making that deficiency by compensating in other thing. So what happens here? Yes, all of your answers is very correct, students. Yes, the answer goes to option A, that is our compensation need. So then what is the suppression, sir? What is the repression, sir? Yes, what is the regression, sir? Yes, I will give each and every word. I will give example, and I will convey you how to understand and how to solve the question over these questions. Okay, so if the situation is coming like this, the students is failing in his academic exams, and he is compensating that failure by becoming sport champion of the, yes, sport champion of the college, where that one we call as an ego defense mechanism as an compensation. Okay, very beautiful one. So then what is the repression, sir? Students, there is small differences there between the repression and suppression and repression. Okay. So focus on my explanation. Okay. Keep your eyes closed and listen to my explanation. Okay. So here now, what is suppression? Suppression is there. See students, one student is there. He completed his the basic studies, and today he is going for one big interview. That interview is going to change his entire life. Okay, and at the same point that student has arguments with his girlfriend. Okay, so now to that particular students who is having one life changing interview, and he had the argument with with his girlfriend. Okay, very importantly, now the arguments which are coming as a painful thoughts in his mind, but in front of him there is one life changing interview is there. So he should give the priority for the his interview. Okay, that is very best one. So at that particular time, that particular person will suppress the painful thought consciously. Okay, he will suppress the consciously. That is what we call the suppression. Where the word consciously will come, that change the answer here in the suppression and repression, students. So in the suppression, the person is, yes, consciously suppressing the painful thoughts which are coming in his mind in order to focus over the particular presence reality. So that one we call as in the suppression. Then what happens in the repression? Yes, 3 year back, 4 year back, if that particular person, one person is had the breakup. Okay, so after breakup, there is he is forgetting his girlfriend birthday. Okay, so that is unconsciously he is forgetting from his own mind. So that is one what we call the repression. Okay, if the consciously painful thoughts are coming down, so that is the suppression. Unconsciously, the particular thoughts, the painful thoughts are going away from the mind to the subconscious. We call that is in the repression. Hope the word is very much clear. In both the differences, in the suppression we will doing the consciously we are suppressing the painful thought. In the repression, unconsciously the painful thoughts are going away from the mind due to the time duration. That is what we call the repression. I hope the concept is very much clear about the suppression and repression. Then what is the regression, sir? Yes, let me tell about the regression. One person is there, his name is Ganesh. Okay, so when the Ganesh is in the age of the 5 or 6, when his parents scolds him, he will show some temper tantrum. Okay, so that is good and normal for his age, because the Ganesh is the age group of the under 6. Okay, he can show, he can manifest the temper tantrum. Okay, so how he is manifesting the temper tantrum? So when the Ganesh is scolded by his parents, there is stress in his mind. So that is he is showing in the form of the temper tantrum, where the person that Ganesh is grown up and now he is at the age of the 26. From the 6 he is grown to 26, and when he will go to the morning his work. Okay, so his boss will scold him in his office, but he is now at the age of the 26. Now he is coming back to the that psychological stage where it will keeps him cool and calm. Okay, at the age of the 26 he is manifesting a temper tantrum, means that is what we call the regression. Means the person is returning the gear and going back to the very comfortable psychological zone. We call that is in the regression, students. At the age of the 26, Ganesh should not show any temper tantrum. He should come up with some stress coping mechanisms. But now he is showing the as the temper tantrum mechanism, where in the childhood, after showing the temper tantrum mechanism, so the child gets some relief from the stress. So in order to relieve from that stress, he is adapting to same that, and he is going back to that psychological zone where he will be relieving the stress. That is what we call the regression. I hope the concept is clear. You can understand the regression by word re-gearing, means you are gearing back and going to the very comfortable psychological zone. That is what we call the regression. I hope the examples are very much easier and understandable for you. So this is my effort to easily deliver the content for you all. Hope the concept is clear. Okay, the answer for this question is the compensation, where the students failing the exam and he is covering that, he is making that by becoming a champion in the sports. So that is a compensation, where the some failures are compensated in the form of the or making in the form of the by achieving in the another area. So that is the compensation. Okay, I hope the all four ego defense mechanisms are very much clear for you all. Okay, so let me go for the next question. Here is the next question for you all. Let's read the question carefully. This is also a question from the ego defense mechanism. Four we have discussed, then four we will discuss here, then four we will discuss in the next question. Okay, that's what in the three questions I want to finish entire your ego defense mechanism, students. That is very much helpful for your exams. Okay, here's the question for you all. Let's read the question carefully and try to answer for the question. Yes, read the question carefully. The process, yes, very importantly, all of you have corrected answer. Yes, the process in which the individual justifies the failure or unacceptable behavior by giving the socially approved reason identify the this ego defense mechanism. Yes, students, what happening here in the process where the individual is justifying, the word you focus over here, the he is justifying. Okay, he is justifying his failure or unacceptable by behavior by giving the socially approved reasons to it. He is giving the, yes, he is justifying his failures. Okay, he is justifying his misbehaviors. Okay, by giving the socially approved reason. What we will call this one? Yes, our option A is the displacement. Option B is the sublimation. Option C is the rationalization, and option D is the projection. Yes, students, let me explain it. Then at the end, I will tell the what is the exact answer for this question. Yes, what is the displacement? Yes, can anyone can text? Yes, let me explain for the displacement. What happening in the displacement, students? See, I will give another example where the person is going to the office in his morning. Okay, so in his office he didn't completed the task, and his boss is calling him to his room. Okay, and he scolded that particular person like anything in the morning. Okay, so he can't scold back the boss there. Why? Because he is his boss. If he is scolding back to the boss, means he is higher here. He is in the higher situation. Here in the higher, the boss is in the higher designation. We can't scold back to the boss. Where the that particular person coming evening, he is coming to the home evening after completing his work, and whatever the boss scolded to him, he is yes, he is discharging that particular aggression over his wife, over his children's, means he is throwing and he is displacing his the conflicts thoughts that are very painful in his mind in the less threatening objects, less threatening situation, less threatening person. We call that is in the displacement. What happens in the displacement? The person will trying to, yes, the trying to vomit out, trying to eliminate it out the particular situations, the painful thoughts or the less threatening objects. We call that is in the displacement. I hope the concept is very much clear in the option A. Okay, that's the displacement where the person is justifying and reasoning. So there is no any relationship between the displacement and this question. So we are eliminating the, yes, option A we are eliminating here. Okay. Yes, let me eliminate option A. So then what is the sublimation? Yes, what is the option B? Just comment in the comment box. Yes, sublimation. Students, I will give one more example for you all to understand the sublimation. Yes. Then what is the rationalization? What is the projection? Just try to answer for this one. Yes, yes, all of you have mentioned the answer as correct, option C. So where the person is giving and he is justifying his failures and unacceptable behavior by giving the socially approved reasons. So that one. So here he is giving the reason, means he is giving the rationalization. Here he is justifying the his abnormal behaviors. So he is giving the rationalization. For example, one person is repeatedly drinking from the 3 years. So when the psychiatrist asks that person, so why you are adopting this maladaptive behavior to get resolve your stress? So the patient repeat back to the like psychiatrist, sir, I am having the 10 crore of the loan in bank. Okay, sir, my wife is daily is scolding me, and she is responsible for my behavior like this. The person is repeatedly telling like this, means he is giving the, yes, the rationalization. What is the socially unacceptable behavior is there? That is the alcoholism. He is justifying his behavior. He is giving the reason for your maladaptive behavior. That is, he is giving the rationalization. So that is the option C is the correct for this question. Okay, and then what is the projection? Yes, option D is the projection. Yes. What is the projection? Simple, students. Projection is an, yes, passing the blame on others for one's own what we call one's own mistakes. We are passing the blame on others. Yes, let me give an example for on the projection where one surgeon is there, and for assisting that surgeon, one more assistant surgeon is there. All of you know that in OT, so one main surgeon is there for assisting that main surgeon, one more assistant surgeon is there. Okay, so what happening here? So they have both have did the surgery for one patient, and the patient come with the surgical site infection. Okay, to the OPD, and that doctor, actually the main doctor who did the mistake, who is passing the blame over the assistant surgeon who is beside of him. He is simply blaming that assistant surgeon because of his own mistake. He knows that is his mistake, but he is blaming the others for his own mistake. That is what we call the projection. And sublimation, in the next question we will discuss the related to sublimation. There is one special question is there for you all. Okay, so I hope the displacement, rationalization and projection is clear here. Okay, so projection is the passing the blame for on others by for our own mistake. That is what we call the projection. Displacement is the discharging their yes the painful thoughts on the less threatening object. That is the displacement. And rationalization is the justifying and giving reason for the maladaptive behavior. That is the rationalization. Yes, I have given the example for all these questions. I hope the concept is clear. Yes, here is the next question for you. Yes, try to answer for the question, students. Let's read the question carefully and try to answer for the question. Question is like this. Yes, all of you have answered correct for the last previous question. I am very proud of you all. Just maintain consistency daily in the 6 p.m. live class with the master nursing classes. Together we will discuss, together we will grow, and together we will reach our goal, students. Yes. The question is like this. Consciously replacement of the highly valuable object, emotion, feeling by object that is more acceptable by the ego. Yes, what happening here? So if the person is having some conscious replacement over one particular highly valuable object with the yes the object which is more acceptable by the ego. Yes, let me clarify on this question by giving the example. Yes, the one person is he want to do the engineering. Okay, so he didn't get any engineering seat, so he is now doing the as the diploma in the mechanics. Okay, so his actually highly valuable object is his engineering, and now he is doing the diploma in mechanics, where he is replacing consciously he is replacing his highly valuable object, okay, emotions, feelings to the that is more valuable. Means in that also he becomes the mechanical engineer, becomes the mechanics. Here also he wants to become a mechanics. Oh, so the purpose of the replacement is the similar only, where he is replacing the highly valuable object is to the yes the more acceptable ego he will replacing. So what we will call that one? Yes, we will call that one as an yes option C. That is the substitution is a condition where the person replace the highly valuable object to the object, feeling or emotions to the object that is the more acceptable by the ego. That is what we call the substitution, where the students who want to become an engineer, he is now a as the completing his what we call the diploma in the mechanical. Okay, so I hope the concept is clear for this one. Okay, then what is undoing? Undoing means yes, what is undoing? Undoing means not doing. What is not doing? So not doing any destructive things to the person who actually you hate, but you are doing the opposite thing where you will buying a gift for him. Yes, let me explain what is undoing. So you will hate your boss in your office. Okay, so when you went morning, okay, so you actually hate the what we call boss. Okay, you can't pass a blame on him. Okay, you can't place a comment on him. So where you are doing sorry, where you are what we call you can't blame him and you can't pass comment on him. So where you are buying a gift for him means you are not doing any destructive things, you are doing the opposite things for him. So we call that is in the undoing. Okay, not doing any destructive things, where the yes we will replacing the destructive things into it and buying a gift as an opposite things, we call that is an undoing. What is the intellectualization? Yes, in the intellectualization, the very best ego defense mechanism, where the person thinks intellectually, and so he will try to comes to the reality as early as possible. That is what we call the intellectualization. Okay, let me give the example on the intellectualization. Where one person get lost his loved one, okay, recently, and now he is compensating. Means now he is applying the ego defense mechanism as intellectualization, where it comes to the reality that the death is a natural one. Means natural process means one see person will born means he will die one day, so that is a natural person, so he will come in contact with the reality and he will come out of that particular situation. That is what we call the intellectualization, where the person always to try to connect the reality rather than the yes the being suffering and being suffering and going into the depression, he is coming to the reality. So that is what we call the intellectualization. Okay, so I hope the concept is clear. And what is the reaction formation? Yes, reaction formation is there, where like two siblings are there. Okay, so I will give example. Two siblings are there, the elder one and younger one. where the younger one hates the elder one. Okay, so where the younger one can't blame his elder one, where he is showing the exaggerate. Actually, he will hate, but when his brother will come, he will show the exaggerated respect towards the brother. So where he is doing the exact and opposite thing, what he is thinking, that is what we call the reaction formation. Okay, so the answer for the question goes to the yes option C. That is the sublimation, where the reaction formation is the yes doing the exact and opposite things. So that is the reaction formation. Intellectualization is the yes trying to connect with the reality and thinking logically and trying to connecting with the reality. Okay, undoing is the yes you are not doing any destructive actions. So you are instead of that you are buying a gift for your haters. So that is what we call the undoing. Okay, so the here the consciously replacement of the highly valuable object to emotions feelings to the object that is the more accepted by the ego, we call that is in the intellectual sorry sublimation substitution. So the answer is very much clear for you all. Okay, we are substituting means substitution means what, where you will see in the pro kabaddi league, where you will see in the IPL. So where in the last times we have uploaded new roles, that is the substitution means one will go out and one will come here. Okay, where the highly acceptable object is going out, okay, the more acceptable object by the ego is coming in. So that is what we call the substitution. I hope the concept is clear for you all. Okay, so here is the next question for you all. Try to answer the question and read it carefully. Yes, the question is like this, students. Where let me read the question. Identify the type of the crisis where the adjustment and adaptation required for the yes the primary gravida to play a role of the mother. Yes, here is the question related to the crisis, students. So these all given mentioned answers are the yes, the types of the crisis where you need to identify which type of the crisis where according to data that is given in the question. So what happening here? Identify the type of the crisis where the adjustment and adaptation is required for the primary gravida to play a role of the mother. Okay. So see what happening here. There is one mother who is first time pregnant. We call her as a primary gravida mother. Okay. Okay. We call her as a primary gravida mother. Means the a lady who is the first time pregnancy, we call her a primary gravida mother. So when she becomes gives delivery to that baby, okay, that baby will come out. Okay, that baby will come out. So now she become an yes the primary gravida pregnant lady too, and is the mother. So now her role is very much changed. Okay, so there is sudden drastic change in her role. She need to take care of the baby. Okay, she need to give breastfeed to the baby. Okay, she need to prevent all kind of the infection to the baby, and she need to take care of all the clothings and cleanliness of the baby. Okay, the extra work is adding to her life where she need to adjust and adapt to that. So this is an yes this is an this type of the situation will come in the everyone's life. Okay, so when the girl matures from the yes the pre-pubertal state to the puberty, puberty to the menarche, menarche to the pregnancy, pregnancy to the mother. So this is what we call the maturation. Okay, it is what we call the maturation from the yes the very big very small girls to the puberty, puberty to the menarche, menarche to the yes uh, pregnancy to the mother, where she is going to the various crisis. Okay, where she need to adjust. See, one girl is simply playing and enjoying and is spending her life. Suddenly she got the start of the menstruation. So the first time menstruation we call as the menarche. Okay, now she is going in the some kind of the physiological changes, psychological changes. Okay, she need to adjust for that thing. Okay, that is what we call the crisis which is coming in the everyone's life. That is the yes the that is one the maturation crisis. I hope the this particular example is very much clear for you and the concept is very much clear for you. Okay, the crisis which is coming in the everyone's life where they need to adjust and adapt to the situations, so we call that is in the crisis. Okay, that is we what we call that is in the maturational crisis. So then what is the social crisis, sir? Yes, social crisis is any kind of the disequilibrium that occurring in the society which leads to the destruction of the yes the property in the large. Okay, and destruction of the yes their what we call the society in the large, we call that is a social crisis. The examples of the social crisis like this is the thunders, okay, earthquakes, tsunamis, nuclear war. Okay, the war between two societies and two cultures, so which is destroying the society in large, where there is a disequilibrium is creating, so we call that is the social crisis. Okay, so that is a social crisis. Then what is situational crisis? The situational crisis is then, yes, it is a that condition where the complete disequilibrium occurring, okay, where the coping mechanisms are failing to control over the emotions and feelings, okay, so which leads to the alteration in the physiology, psychology and social function of the person. We call that is a situational crisis. Sir, you have told the definition, we are not understood. Yes, let me explain in the normal language only. Yes, consider one person who is taking care of his entire family, and he is the only one person who is having the income source to his family, okay, and he wants to pay some 30 to 40,000 EMI per day, sorry, per month, okay, and he is having the responsibility of his younger sister to get married, okay. So the person who is having the lot of responsibility is going daily going to the work and earning. Suddenly he got the accident and he got damaged of his both legs. So then think about their family. Yes, think about their family mental status. Yes, think about their family emotions. Where there is only one income source to their family. Yes, monthly they need to pay some amount to the bank. Yes, they are having the responsibility to responsibility to the marriage of his sister, okay. So there is sudden drastic changes, okay, sudden drastic disequilibrium which are occurring in their family, with changing entire their mental function, social function, psychological function, yes, the physiological functions also altering. So where that is what we call due, that is occurring due to one particular situation. So that is what we call the situational crisis, so which occurs due to the, yes, when which occurs, yes, the one person is suddenly getting dismissed from the job, suddenly getting fractures for the legs, okay, suddenly having some mental severe mental illnesses, okay, some suddenly they are having some serious medical issues. So that is disequilibrium arising due to the some sudden unpredictable situations. We call that is in the situational crisis. Okay, hope the concept is clear, where the examples are coming like this: road traffic accident, okay, getting severe uh, medical diagnosis, okay, having a severe psychological and mental illness, so which creating a situation disequilibrium, so we call that is such a situational crisis. If the examiner given the, yes, examples like earthquake, tsunamis, thunders, okay, where and rivals between the two cultural communities, so that is comes under social crisis. Okay, if the examiner given the uh, examples like this, the adjustment and adaptation for the primary gravity to the mother, and the pre-pubertal girls to an menarche girl, okay, and so that is making the, so that needs the actual adaptation, so we call that is in the maturational crisis. Okay, hope the concept is very much clear. The answer for the question goes to the option B, where the mother where the primary gravida is having the role of the mother, okay, by adjusting the adapting, so that particular disequilibrium makes the crisis here, so we call that is in the maturational crisis. Hope the concept is very much clear. Okay, by this one particular question I have cleared entire type of the crisis. Okay, let me go for the next question. Here is the next question for you all. Yes, read the question carefully and try to answer for the question. Yes, read the question carefully, students. In which phase of the crisis severe anxiety, okay, profound cognitive, emotional and psychological changes occurring? Yes, students, in the crisis we are having the four phases of the crisis. There is phase 1, phase 2, phase 3 and phase 4, okay, where we will get due to the some unanticipated, okay, due to some anticipated precipitating factors, we are having some anxiety, okay. So see, look at me, listen to my explanation carefully, okay. I'm creating one situation in front of you, okay. See, some due to some unanticipated dangers, due to the some anticipated mishaps, the person is having the some kind of the anxiety in body, okay. So in order to cope up with that anxiety, our body having the some kind of the coping mechanisms. So when there is anxiety along with coping mechanisms are coming, okay, so that coping mechanisms are suppressing the anxiety, means the stress or the crisis will resolve in the phase 1 only. But if our coping mechanisms are unable to control the stress, the anxiety, the unanticipated danger stimulations, means the person will go into the next phase. Okay, what happens in the phase one? Phase one, it happens. Okay, our coping mechanism activates, try to suppress all the kind of the yes the crisis disequilibrium. What happens to the particular situation? Okay, if it is small one means it will get control in the phase one. Okay, so if it is not controlled by the those coping mechanism, it will enter into the phase 2. So phase 2 when it begins, phase 2 begins when the failure of the phase 1 occurs. Okay, so then what happens in the phase 2? So phase 2, the patient is having yes the he is having the some like he is having some anticipation of the danger in the phase 2. Okay, where he will try to adjust for that particular situation, randomly adapting coping mechanisms where that actually don't works actually. So the person is randomly adapting, like he is following some maladaptive behavior to control with the situations, means he will take some drugs, some alcohol and all to in order to just cooperate on in order to compress that particular crisis where it actually don't work. Then failure of the second phase will go for the third phase, that is the phase 3, where the entire crisis situation is redefined, and entire crisis situation is redefined. Our yes the problem solving ability, yes the abstract thinking is applied and utilized and solving the crisis which occurs in the phase 4. Okay, what happening is, sorry, which occurs in the phase 3. What happening in the phase 3? Our entire crisis situation is redefining. Okay, after redefining the entire crisis situation, we are applying the some new learning abilities. Okay, some new problem solving abilities and some new abstract thinking in order to control the yes, crisis, and in order to maintain the equilibrium over the life of that particular person who is went under the crisis. So that is our crisis will resolve over the phase 3. If even after applying the all abstract thinking as the coping mechanisms, the stress still not resolving means it will go for the stage 4 students, where what happens in the stage 4 as the profound cognitive, emotional and psychological changes will occur, where which will ends with the yes, some dangerous damage to the person, or it will ends with the death of the person. So we call that is in the phase 4. So these 4 pages where I have explained all the characteristics of the 4 phases. Okay, so in which particular crisis phase, okay, where the cognitive, emotional, psychological changes occurs, that occurs in the phase 4 of the crisis phase. Hope the concept is very much clear for you all. Okay, so here is the next question for you all. Read the question carefully and try to answer for the question. Okay, so here is the question. Yes, yes, you are trying, but this is the new topic for you all, but the crisis is a very important topic. How in the cardiology, while studying the cardiology medication, the digoxin is important, no? Like that only, the crisis also important topic for the exams, where the examiner may arise the question over this one. Okay, many of the students is unable to answer because they don't know the concept. Because no one is teaching the concept. Everyone is behind the MCQs where they will like where the complex parts will seen measles, like this one, where the vital spot will seen vitamin A deficiency. Everyone is teaching like this, no one is clearing the concept. Then how will the students will clear their answers? So don't run behind the question, students, just run behind the concept. That particular one concept is help you like anything, that you may solve the by applying that concept, you may solve the many other 100 questions, students. That makes you a clear champion and true aspirants. Okay, so just run behind the concept, so that helps you a lot. Okay, so here is the question for you all. Okay, read the question carefully. Yes, in which type of the crisis resolution, okay, phase, a person using the pathological way to get out of for the situation. Okay, so we are having the as the type of the crisis we have discussed here in the last one. Okay, social crisis, situational crisis and maturational crisis. Then phases of the crisis we have discussed while the crisis resolution. And here is the we are having the 3 ways to resolve or come out from the crisis, or come out from the bad situation which happens in the life. So those 3 situations are like this. The stress, crisis resolving phases we call, yes, that is a successful resolution, unsuccessful resolution and pseudo resolution. We are having the 3 ways to get out of the crisis. Okay, that is the 3 way, those are success, unsuccess and pseudo resolution. Okay, so in which Yes, in which crisis resolution phase, where the pathological way the person is adapting to come out of the situation. Yes, in the successful resolution, students, what happens actually in the successful resolutions? Okay, the person utilizes the problem solving abilities and he will come out of the crisis. So that is where he will going back to his normal physiological and life after applying the problem solving abilities. Okay, he will comes out of the crisis. So where the person will not adapt to any pathological way. What is the pathological way? So the person what he is trying to get out of the crisis, the person is using some pathological way. So what is that pathological way? The person may use the alcohol, if the person may get drug addict, if the person may chew the gutka and all. So that those are the pathological way where the person trying to get adapt for the situation. So those are not a normal way. Okay, so those things we will see in the unsuccessful resolution, where the person is not getting any way to get out of the crisis and he is adapting to the pathological way. Okay, the pathological way indicates includes, yes, our intake of the alcohol, there is the, yes, drug dependence. Okay, and other ways like having the gutka, okay, and all. So that is the unpathological way to get out of the get out of the crisis. We call that is in the, yes, the unsuccessful resolution. So that is the answer for our questions. So in the, yes, in the, yes, the crisis resolution, the person is adapting to the pathological way means, so we call that is in the unsuccessful resolution. Then what happens in the pseudo resolution? Yes, in the pseudo resolution, person uses the excessively, yes, which ego defense mechanism the person uses the, yes, very importantly, repression, where he is forgetting unconsciously, he is keeping the, yes, his painful thoughts out of the mind. Okay, if the person's crisis if reoccurs means that again that particular what we call the crisis, it will comes in the surface of the mind, which damages the persons in the future. So the pseudo resolution is not good. If you have any problems, just solve by successful resolution only. So yes, the pseudo, what happens in the pseudo resolutions, pseudo in the cancer means the false resolution. Actually, the crisis is not resolving. The person is using the repression. Okay, he is putting that particular crisis in his subconscious state, and he is functioning normally now. If in case that crisis occurs again means again it will comes to the mind. Okay, so it will harm the person. So I think the pseudo resolution is very much clear for you. Yes, let me go for the next question. I hope this answer is very much clear for you. Where the person is using the pathological way to get rid of for the situation crisis, we call that is in the unsuccessful resolution. Okay, yes, hope the answer is clear. Here is the next question for you. Yes, we are discussing the mental status and mini mental status examination. Important question here. Okay, so hope the crisis questions helps you. I have covered entire crisis question. Okay, so here is the next very important question for you all. Read the question carefully and try to answer for the question. Yes. Which of the following is not a component of the mini mental status examination? In the last previous session, I have asked one more question over the mini mental status examination. Yes, in which situation only and only we uses the mini mental status examination? Yes, all of you have answered that one correct as in only to assess the cognitive ability of the person. We applies the mini mental status examination. That is usually we will use that one only in the person who is having the cognitive defect like dementia, like delirium. Okay, so we have discussed over that in the last class. Okay, so now tell me which of the following is not a component of the mini mental status examination? Yes, all of you have mentioned the answer. Yes, some of you are wrong and some of you are right. Yes, let me answer for the question. Okay, so that will clear your concept, students. So what are the components we are having in the mini mental status examination is like, yes, oral. You can remember that one by as a remember oral. Okay, so we are having the five components. First one is the, yes, the orientation. First component is the orientation, then registration, then recall. Okay, then attention and calculation, then we'll having the, yes, the language. Yes, the language is our components. Okay, and attention and calculation is our components. Okay, registration is our components. Yes, recall is also our components. Yes, orientation is also our components, where the general appearance is not a component of the mini mental status examination. Students, this is an yes the very important and vital components of the mental status examination, where we will assessing all components of the mental status, that including the general appearance, speech, thought, okay, and we are also assessing the yes still more I will explain in the mental status one. Okay, so where the general appearance we will assess in the mental status examination. Okay, so in the mini mental status examination, yes, in the mini mental status examination the components are like this: orientation, yes, the registration, recall, yes, attention and calculation, and language. Then how we will assess this one? Yes, let me discuss. So we are having the total 30 marks for the total 30 marks for the mini mental status examination. Okay, so in for the orientation we will give the 10 marks, for the registration we will give the 3 marks, for the recall we will give the 3 marks, then attention and calculation we will give the 5 marks, and for the language we will give the 9 marks. Is count down, count all of this, yes, the answer will be 30. Okay, so then what is the normal score of the mini mental status examination? Students, the maximum score is the 30. Yes, in the last class also I have told the score more than 24 is the normal. Okay, if the score is between the 24 to 30 means normal. Okay, and if the score is between the yes, very importantly, 18 to 24 means that is a mild cognitive defect, and if the score is from the 10 to 18 means that is the moderate cognitive defect. If the score is less than 10 means that is the severe cognitive defect. I have explained in the last class only. Okay, very important scoring system for the mini mental stress examination. Hope the concept is clear. The highest marks, highest marks for which components we will give in the mini mental stress examination? Yes, students, that is we will give the highest marks to the yes the orientation one, where we will assess the 10 components in the orientation, and we will give the 10 marks for the orientation, and the lowest marks is for the registration and recall is there. Okay, 3 we will give, and the second highest is for the language. We will give the 9 marks by assessing the various components in the language also. Okay, I hope the mini mental stress examination is clear. Only we will use the mini mental stress examinations to assess the cognitive function of the mentally healthy or unhealthy person. Okay, so where the mental status examination is, we are using to assess the each and every components of the yes our what we call psychiatric person. Okay, so here is the question over the mental status examination. Here the last question is on the mini mental status examination. Okay, so read the question carefully and try to answer for the question here. Which of the following is in first component of mental status examination? Students, we are having the various components in the mental status examination. Okay, that starts with G, S, T. Okay, GST, and very importantly uh, as the general appearance, speech, thought. Okay, and kind of it. Yes, let me 1 minute, please. I will mention the answer here. Yes, students, the components of the mental. This one I will comment in the comment box at the end of the class. You will know. So that slide is deleted from here. Okay. So yes, we are having the components like this. The first components is the yes our general appearance and as general appearance and the behavior. Second one we will assess the speech and thought. But the first components they have asked in the question. So the first components goes to the yes the general appearance and behavior, where we will assess the all type of the so general appearance like how is the grooming status, how is the cleanliness, how is his response. Okay, each and everything we will assess. Then we will assess the speech. Okay, speed of the speech and all. Then we will assess the mood and affect, thought and all. We will assess in the mental status examination. Okay, so the enter all components I will mention in the comment box at the end of the class. You will see in the comment box. Okay, so these are all the components of the mental status examination. The first components of the mental status examination is the very basic one. So we will see first the how the generally appearance and what is the behavior of the patient we will see in the as the first components of the mental status examination. I hope the concept is clear for this one. Okay. So I will mention with the mnemonic students. Okay. So that slide is deleted from here. Okay. Here is the next question for you. Yes. Read the question carefully and try to answer for the question. Yes. The question is like this. Nursing officer is asking to write a word apple. Okay. What the nursing officer is asking to the patient to write the word a apple like this. She's already having the one word. Okay, she's asked to write the word apple in the backward. Okay, she wants the patient to write the word in the backward like apple. The patient should write like a l, okay, double p a. Okay, so these are the five word. Okay, five words. If the okay, and the nurse wants to the patient to write this particular word in the backward and giving the 1 point for the each right placement of the word, which components of the cognitive assessment, cognitive function she is assessing here. Okay, so yes, students, the nursing officer is asking the patient to word the mention write the word in the backward as the apple. Okay, if the person is mentioning and writing the word apple in the written direction very nicely and with the proper placement of the spellings. Okay, so for each spelling proper placement we will give the one marks. Okay, 1 marks for this one, 1 marks for this one. Okay, one for this and one for this and one for the last one. If he is writing in the proper direction means with the proper spellings from the backward, so we will give the complete 5 marks per year. Okay, if the one word is misplacing means, so we will deduct the -1. Okay, so what happening actually here, the nursing officer is asking to write it in the backward means she is trying to assess. So she is trying to assess the very importantly our orientation. How we will assess, students, the orientation? In the orientation we will assess the 10 components of the orientation, that including we will ask the patient to which year this is, then which month this is, which season, which date, okay, and which day. Okay, 5 components. Or then we will ask the patient to tell where you are in the which country, which state, which city, which hospital, and which floor. So for each and every questions there is one answer, one answer is there. So if he is telling everything normally means we will give 10 out of 10 score for the orientation. And for the attention and calculation, okay, for attention and calculation we will see the patient attention. Okay, if he is placing the words in the backward in the proper position means his attention is very nice. Okay, so that is where in this particular situation we are assessing the, yes, we are assessing the attention here, students. Okay, attention and calculation is the answer for this question, where the nursing officer asked to ask the, yes, ask the patient to write the apple word in the backward direction. He is written in the proper way means for each and every word. So each and every word, yes, the nursing officer will give one marks. Okay, the total marks will be 5 to attend the, to answer the, yes, the calculation and attention. Where in the last slide also I have told the, yes, the maximum score we can give for the attention and calculation is the 5. Okay, so hope the concept is clear here. Yes, I have told how to assess the this one also, what we call attention and calculation, where we will assess the recall and registration. Like we will tell the 3 words to the patient. Yes, the what we will tell, pen, notebook, and juice. We will tell the patient, and we'll ask the patient to repeat all those 3 words. If he is asking, he is telling the all those 3 words like pen, his book, and juice return to me means he is registering what I am telling. He is registering in his mind, so his resistance is normal. So we'll give the 3 marks. And after some time we'll ask the patient to whatever the 3 words I have told previously to assess the registration, please tell those 3 words. We will ask the patient. Okay, he is telling those 3 words in the correct means he is telling the only pen and notebook means he is not forgotten about the juice means we are assessing the recall, where the person is able to tell or repeat that one or not. We will assess in the recall. Okay, so after registration, so we will assess for the recall. So for registration and recall we are having the 3 marks. Okay, total marks for the mini mental status examination is 30, where in this particular situation the nursing officer is assessing the attention and calculation of the person. So I have told how to assess the recall, registration, and orientation also. Okay, very importantly, this is the very important question for your exams. Okay, here is the next question for you. Yes, this is the question, students, where I have explained in the last class. Okay, and I have told I will give clarification for this question because there is one option printing mistake were there. So this is the question in the last class we have discussed. Which of the following vitamin deficiency is not responsible for the dementia? Okay, so while explaining, I have told vitamin B6, vitamin B9, vitamin B12. These all are the neuroprotective vitamins which keeps the the homeostasis in the control. Okay, if in the deficiency of the vitamin B6, B9, and B12, okay, homocysteine will increase. So increase in the homocysteine, which damages the nerve fibers, okay, which leads to the deficient, which leads to the occurrence of the dementia. Okay, so this is the what the concept I have explained actually. And the option D I have given as the vitamin B3, that is the misprinted one. So I have told in the that that particular situation only I have explained you. There is the option misprint is there. I will give clarification. Okay, here is the clarification you want. So that is the actual option is the vitamin B2. Okay, so in the last class I have told I will give clarification over that question. This is the clarification for that one. So deficiency of the vitamin B2 as the riboflavin. We have discussed about the deficiency of the riboflavin in the yesterday's class also, where there is stomatitis and cholestasis occurs. And one more vitamin deficiency which leads to the the dementia, that is our vitamin B3. Okay, that is our niacin. Niacin deficiency lead to the pellagra. Okay, what happens in the pellagra? Yes, in the pellagra, 4 days will come. Yes, one day for the dermatitis, another day for the diarrhea, death, and dementia. Okay, diarrhea, death, and dementia. This dermatitis, diarrhea, death, and dementia. These are the 4 days of the pellagra. Okay, where you will need to keep in your mind. And in the pellagra, yes, around the neck. Okay, consider this is the body of the patient. Okay, so this is the neck of the patient. Where around the neck there is burning like dryness of the skin with discoloration of the skin in the paragraph we call that is in the causal necklace. So that is seen due to the deficiency of the vitamin B3, that is the niacin. So in the paragraph we will see the causal necklace, and 4 days are the classical features of the paragraph. Wherein the deficiency of the vitamin B3 also leads to the dementia, but the pathophysiology is different. In the vitamin B6, B9, B12 are the vitamins which are responsible to keep the homocysteine in control and which helps to regenerate the neurons. Okay, where there is a deficiency of the B6, B12, B9, and B12, which leads to increase in the homocysteine. So increase in the homocysteine leads to the increased damage for the neurons. Okay, that creates the the our dementia. Okay, so but deficiency of the vitamin B2, that is the our thiamine. Sorry, that is our what we call riboflavin is not related to the association with the dementia. So we need to consider the answer as a not. So our B2 is not responsible for the dementia. So answer for this question is the vitamin B2. Okay, that is the our riboflavin is not responsible for the dementia. Okay, I hope the concept is clear. Here is the one more question is there for you all. Yes, very important one. So the duration of the parole is, what is the parole? Yes, anyone know what is the parole? Yes, giving the temporary discharge or giving the temporary leave to the psychiatric person to go and meet their family friends, to meet their family persons, and to attend their family functions for a certain period of the mentioned time only. For this many days and this many time, we will give the permission to patient to go out of the hospital and meet their family and friends. Okay, that is what we call the parole. That is the temporary leave the psychiatric patient is getting from the hospital to attend the family functions. But you have to remember, as a nursing officer, there should be a consent taken by the doctor from the the bystanders or the attenders of the patient, where the complete responsibility of the patient is taken care by their own family members. Okay, and there should be their signs should be taken in the doctor's notes. Okay, in order to give permission. Okay, and they should sign over the consent also, and the parole will be for the only specified time. They should submit the patient in that particular specified time where the doctor mentioned to the patient, and the maximum duration we can permit the patient to go out of the hospital is in the parole is only and only, yes, very good students, that is only and only 60 days we can give the maximum. More than 60 days we will not allow the patient to be away in the, yes, in the environment, because the patient may harm to himself also, and patient may harms to, yes, others also. That's the why we will keep the person in the, yes, the psychiatric hospitals. So up to 60 days we can give the temporary leave to the person, where the entire responsibility of the psychiatric person is taken care by the person who signed in the informed consent. Okay, especially, yes, there should be their family members only. Okay, I hope the concept is clear. The duration of the period is parole is only up to 60 days. Okay, I hope the concept is clear for this one. Here is the next question for you all. Yes, read the question carefully and try to answer for the question. Yes, which of the following indicating suicidal threats in the psychiatric ward? Okay, so this is also from the emergency, psychiatric emergency topics. Okay, where I have collected this one. So rest all thing I have explained all the emergency while telling the previous classes only, like while telling the schizophrenia we have discussed about the paranoid excitement all. So that is also, and histrionic, while explaining the histrionic fits and histrionic personality I have told the histrionic attacks also. So those all are the, yes, the very important emergencies we have covered. So don't worry if the question is coming from the other emergencies. Yes, you will definitely, I'm sure, if you have watched my previous video, you will definitely answer those questions as the right questions. Okay, so here is the question for the, like you all. Yes, very important students. Yes, very good, very good. All of you have given the correct answer. Yes, which of the following indicating the suicidal threat in the psychiatric ward? Yes, if the person is writing the farewell letters to their friends and families, whether the farewell means the person wants to go away. Yes, the person wants to leave the earth. So where he is writing the farewell letters to their friends and family. Okay, where that indicates the patient is giving some clue to, yes, get suicide. Okay, this is also indicating the suicide. And making a will, he is making a will, some bonds between some charity and him. So where his entire property will go to their families or else some charity and all. So if he is making a will means that is also indicating, yes, he will go for the some permanent decisions, he is going for the suicide. This is also indicating the threats of the suicide. And if the person is suddenly appearing peacefully and happy after the depression means that is also indicating that the patient may go into the suicide, where the answer for the question goes the, yes, all the above. Where in other condition, how you will identify if the person is directly giving the threat, I'm going to damage myself, that is also indicating the suicide. Okay, so the what is the nursing responsibility to prevent the suicide? So we will give the high attention towards the patient. We will keep the patient towards the nursing office room. Okay, so where we can observe the patient directly, completely. Okay, so and other we will remove all the threatening objects from the environment of the patients. We will don't keep anything that is sharp in the patient's accessibility. Okay, where we will not allow the patient to put the what we call lock for the door inside. Okay, so that is the nursing responsibility in order to prevent the suicide in the, yes, the very severely depressed patient and some schizotypic personality patients, and in other situations also where the person is went into, yes, the higher state of the excitement also, where we will applying the suicide prevention activities that helps to prevent the suicide. Okay, so I hope the concept is very much clear for you all. So we have tried a lot, students, we have studied a lot together. Okay, so we have brought a lot of the concept. Okay, I am trying to clear the each and every concept very clearly and in the easy understanding manner. Okay, if you found the video very informative to you all, please do subscribe to the channel, share the content with your friends, with your students, juniors, seniors and all. Yes, let me help to grow my channel, and let me help to and support the other students also who are actually need of the study, and who are actually wants to become a champion in the, that's the central government nursing officer exam, students. Okay, so here is the end of the question answer discussion. Yes, wait, students. I am giving some very important tricks and tips for your exams here. Okay, so we have done the entire psychiatric nursing. Okay, for the Nimhans, all of you know that the question paper will come into the two parts, where it will come as a part A and part B. Okay, where there is a nursing and non-nursing questions also there. Okay, then you need to go with a cool, calm mind. Okay, so how you will approach the paper? Just relax yourself. Yes, all of you have to should come for the Bangalore and settle one day before only in the Bangalore. Okay, So make a book of the hotel and take rest just one day before the exam. Be cool, calm. Okay, the whatever the question answer we have discussed, almost all same these topics only will come in your exams. Okay, don't do any hurry burry. Just focus on the important words while reading the questions, where the examiner may mention the except, not, all the above, none of the above, least important, most important, least priority, most priority, and all. Okay, just read all the option carefully. Okay, once you read all the option carefully, then just apply your concept whatever you have studied in the master nursing classes. Okay, so the almost 35% syllabus will come from the anatomy physiology of the nervous system. Okay, from the uh, our what we call the medical surgical nursing. Okay, especially from the neurology of the medical surgical nursing, where the head injury, seizure, multiple sclerosis, and all come. Okay, and just from the psychiatric nursing, including these three subjects, the 35 to 40% subject will come. Okay, especially I have dealt each and everything in detail regarding the neurology, anatomy, physiology, all neurological disorders, and the psychiatric. We have conducted the crash course from the day 1 to the day 8. Okay, we are finally happily. Okay, we have completed our psychiatric nursing also here. So if you have any doubt, do mention in the comment box. Okay, clarify your doubt before going to exams. And so if the how we will attempt the questions, the first part, the part A will come in front of you, that is the nursing questions will come in the around 80 questions will come. Okay, among those you have to mark whatever you know, and if you don't know the answer, don't mention the wrong answers. Okay, there is a negative marks of the 0.25 is there for you all, so don't forget that one. Okay, how much you are putting the correct answers, and more important than that, how much you are preventing the wrong answers also going to matter for your rank students, that decides your rank very importantly. So keep calm, be cool, and as the approach the question paper, especially if you are completing around the 60 to 65 nursing questions, then you will go for the arithmetic, reasoning, maths, and general english. Okay, where you need to apply some of your general knowledge and think of on those questions. If you are completing around 60 to 65 here, take a risk of the 10 questions attempt there. Your total at the end of the end around you can attempt up to 75 to 78 questions. Okay, don't go behind that. So if you are very sure means you can answer, no problem in that. So if you are having the some doubt, yes, some doubt you are having means just try to control the negative marks. Okay, so be confident, give your best after your exams. So give me a feedback whether it is helpful or not. Okay, so thank you for watching the master nursing classes, and thanks to connecting between thanks to making a good and healthier bond between the master nursing classes and students. So okay, thanks believing in the Mr. Nagraj sir. We will meet in the next sections, that is the NORCET and ESSC golden classes. So okay, NORCET and ESSC golden classes is sure will come within the 2 days in front of you all, where the daily same 6 hours at the 6 p.m. the class is going to become live in front of you all. So we will target the we will break the targets in the particular sessions. Okay, like we'll complete the endocrinology in the 8 days, then we will go for the cardiology, we will discuss each and everything. Okay, daily the topics I will cover here. Okay, by converting the complex tasks into simple task. Okay, we'll read together, we will study together, and we will enrich our knowledge. Okay, thanks for watching the master nursing classes videos. Okay, we will meet in the next class. तब तक के लिए जय हिंद, जय भारत, all the best for your Nimhans exams. Okay.